The Medical and Dental Consultants Association of Nigeria on Wednesday said they embarked on nationwide strike because the federal government has refused to address their demands. This was revealed by the chairman of the Mdcan, Federal Teaching Hospital Owerri, Dr. Samuel Md, while reading the statement signed by the National President and Secretary Mohammed Aminu Mohammed and Professor Dayabu Alhaji Ibrahim, respectively. He pointed out that trouble started when the National Executive Council of MDCAN, after their extraordinary meeting, observed that federal government was yet to address what they described as reckless and utter disregard to due process by the governing council chairman of Nnamdi Azikiwe University, Awka, regarding the position of the VC of the institution. It was their resolve that the federal government should immediately relieve the chairman of the governing council of Nnamdi Azikiwe University of his appointment as council chairman for his insubordination, and to enforce the Ministry to Education's directive nullifying any appointment subsequent to their directives. Other demands by the body centered on the harmonization of the retirement age of medical consultants to 70 years, the harmonization of payment of emoluments of medical lecturers with the consolidated medical salary structure in order to ensure universal applicability of CONMES to all medical and dental offices. Payments of 2023 and 2024 clinical duty allowance arrears and 2023, 25 and 35% arrears. He added that. And the NEC will convene on Sunday, 24th of November at 8 p.m. to reassess the situation and progress made to chart the next course of action. I want to just redirect on something. We've been having cases of doctors leaving the country to foreign countries to practice. And I don't know if this situation is one of the reasons why the Japa syndrome has been on and it's actually affecting us. I would love to get your thoughts quickly, Honorable Churchill.
Yeah.
What do you have to say about this?
First of all, I know that the strike they've embarked on is a very serious one. You know, when I got information about the strike, I looked at it. It's not a good one to the country, because the health affairs of a nation is very, very important. You know, there are two important things me, I believe, as a man. I believe that health and food is the two things that we ask God for, especially in Psalm 23. So, and I believe that Nigeria should look into the affairs of the medical and dental doctors. You know, when you are talking about dental, it's somebody that does not understand what dental is all about. It is very, very important that you collaborate, you bring everybody together. You bring them together. That is the same thing we are saying. The problem of this country, we have not found it out. Now we can't look for the solution. Because until you diagnose something, before you now look at the solution. You cannot see somebody sick and you believe that it's malaria. Until you diagnose that it's malaria, before you start treating malaria. You can't see somebody and you say, this person is having somebody complaining of stomach ache. You've not diagnosed and you say this appendix. You understand? So we should look at the problem of the country, get to find out, then look at the solution. The problem of these individuals or this particular organization is they have highlighted what their problem is. And the major problem of medical doctors, of medical practitioners, nurses, and generally in this country is that Nigeria is not taking care of our health officers. Nigeria is not taking care of our health officers. You cannot tell me that, for example, that a politician has a take back home of 20-something million as a House of Rep member, or 30-something million now in a month, and a medical doctor or a medical practitioner is not taking home 1 million naira. Is he not suffering? Huh? Okay. Do you think the person will be happy working? It's not. The person cannot be happy working. Yes. They are not giving them the attention that they are supposed to give to them.
Okay, thank you.
They are not paying the right attention to our medical practitioners.
Thank you very much, Honorable Churchill. But I'd love to get your thoughts, Mr. Samuel. What is your thoughts about this? Because health is wealth.
Yes.
And then we have, let's say there are cases, there are emergencies that occur, and then the doctors are on strike. We have cases of people that are taken to the hospital on emergency levels, and they say the doctor is not around. The doctor is not around. They sometimes refer them to other hospitals.
Yes.
And then in cases where they are on strike right now, how do you think this affects us? What do you think that has to be done?
What has to be done? It boils down to some of the things we've been looking at since we started this discussion. There is like you said, the Jackpot syndrome. What is responsible for that? Now, where they are going to, why do they think that they have to go there? Why do they consider that pasture as being greener as compared to what we have here? The decay started sometime, and it has continued to, it's been allowed to fester. And so it continues to get bad, to get worse, and to the point where we are today. The health sector is one sector that we are not supposed to hear that they have gone on strike. Why? Is because it is about lives, the lives of Nigerians. The only reason why doctors and medical officers or health workers are allowed to go on strike in Nigeria, or they are dealt with in a manner that they eventually have to go to strike to drive home their point. It's because the impression will be that government does not value the lives of Nigerians. If they are not being paid well, just like the story said, they found out some of monies, that they were supposed to be paid, and agreements have been reached. They are not being paid. The question is, if they go to, if say a Nigerian doctor goes to a place like the United States, and he feels that he's being, because he thinks that he will be more properly treated there, what are they doing there that we are supposed to do here that we are not doing here? It boils down to the issue that I keep hammering on, that institutions in this country are not being built properly. We are not building institutions. We are just having big names as, we will just have a big name as health minister. What are you doing? I want to give an example. In River State, we have an example of a professional that is doing well as Commissioner of Health. We've been hearing stories. He even had to, see, let me tell you, everything you see the governor of River State do in the area of health development, development of the health sector, or development in the health sector, is on account of advice that he is getting from professionals. And how does it come? The commissioner is able to galvanize professionals in the area, in the sector. Come, what do we do? And then they will tell, see, this is what we are supposed to do. See, there are monies that are supposed to go to health officials, medical doctors, practitioners, and all that. We have to give them that money. If we give them that money, attention in that area, attention to caregiving, we are going to have it.
Okay.
And then the governor will follow up. You see him upgrading hospitals here and there. It's not because he feels there is so much money to do that. He's been advised to do it. Where did the advice come from? It's not the Honorable Commissioner for Health. So these are some of the things. Look at the people. Sorry, the medical doctors. It means that whatever they have been saying have been falling on deaf ears.
So something has to be done.
Something has to be done.
Thank you very much.